First thing, what everybody would tell is physical activity. Most of the parents, what they feel is they wanted their child to look chubby, not the overweight and the obese one.
So you're saying chubby is not that cute. Some parents are concerned that, height is not that much. So they give lots of food thinking that it will grow taller.
If they are calorie deficient, child should meet with the adequate calories to have a proper height and weight. I'll tell you a scenario. I had a patient. I told them you have to play sports every 1 hour a day. After 3 months he came and he actually gained some 3 kgs. விளையாடிட்டு தான் இருக்கிறான் டாக்டர். என்ன விளையாடுறான்? ஃபுட்பால் விளையாடுறான். ஃபுட்பால் இவன் வெயிட் எப்படி இந்த தம்பி எப்படி ஓடுறான்? He is playing in video game.
Hello guys, this is Dr. Pal Manikam. Welcome to another episode of our podcast series, Gut Feeling with Dr. Pal. This episode, I would say, I think I really enjoyed it because it is my favorite topic, which is pediatric gastroenterology, like childhood nutrition. What is childhood obesity? How do you diagnose obesity? How are we missing obesity? What is the emotional connection of overweight and obesity among Indian parents, especially in the Indian community? What we should do and what we should not do? How do we go about with feeding the kids? What should we do when they say no? What should we do when they say no to our favorite foods that we think that they are going to be healthy? It was a wonderful discussion. If you are a parent, if you are having kids less than 15 years of age, this is a must-watch podcast. I request you to be throughout the end of the podcast. There are so many good points that I wish all my audience know. So stay till the end. I'm sure you'll definitely learn from it. Let's dive deep into it. Hi, Dr. Rakesh Kumar. Thank you so much for being in the podcast.
Thank you, sir. Thank you for inviting me.
You look so fit.
Thank you.
Which is not the normal for your doctor of your age. Fitness has been a part of your life?
Yeah, I've been following it for the last 10 years and I'm very happy to hear at times that I'm being fit. And what was very normal previously has become abnormal these days. Being fit has been normal earlier, which looks abnormal these days and very new these days.
You are a pediatric gastroenterologist. Yes. Okay, the main reason that we wanted to have you on this is that, being an adult gastroenterologist, I can vent out my frustrations to you. You could do
vice versa. Yes, sir.
So, the purpose of this podcast is to educate the audience in terms of, kids, nutrition, food habits, what are the raising red flags and everything. So that was the purpose of the podcast. And who can be the best source rather than pediatric gastroenterology by yourself. So I'm going to start with saying that how common is childhood obesity in your practice? I'll give you some numbers. Let's say that 100 people come to your practice. How many people will have obesity?
Maybe I'll put overweight and obesity together. Okay. Maybe out of 100, it is 10 as of now. But it depends upon where you are practicing, what is the tier 1, tier 2 or tier 3 city and what sort of patients you are getting. As of now, I would say it is somewhere around 10%. The overweight and obese children are somewhere around
10%.
Yeah.
Is that diagnosis being diagnosed by you or primary care physician or family members?
That was an excellent question, sir. I would actually add that this overweight and obesity is actually underdiagnosed in our society. Sometimes the parents might meet the children, they might take their children to a pediatrician or to some other doctor for some other issue where that issue is addressed and that is sorted out. But sometimes this overweight and obesity is missed. So that is very important. But these days I feel people, also doctors are getting a little aware of that. They are picking up obesity when even the child goes for a simple cough, cold, vomiting, diarrhea. Obesity is also picked up and sometimes parents are also very shrewd enough to notice that and they are asking for that. So I feel after some doctors' videos have come, this obesity awareness has become popular these days.
So mostly I think it is picked up by they come of some other condition.
Yeah.
And then they pick up incidentally.
Yes.
In the US, with me having like 2 young kids, it's a common practice to go for annual physical exam, for vaccinations and everything. And they tell us, okay, for this day you come. Is that the practice over here in India?
Ideally, when a child comes for a visit, we'll keep it as a...
Wellness visit.
Yeah, wellness visit.
No problems.
No problem. Just for a vaccination. Ideally, we have to mark a growth chart. We have to mark a height, we have to mark the weight, and we have to see it for the corresponding age, and we have to mark it in the centile chart. Only then we'll know if the baby is growing appropriate or overweight or malnourished even. So that is very important. And because in our India, since the crowd is very high, unlike in other Western countries. Sometimes it is being missed, but that should be followed. At least we should start following it from now on.
So it's better that you would say a child should be taken to a pediatrician even without any problems at least once a year.
Yeah, at least a wellness visit. Like how do we do for the adults who are around, now we even say 40 years, just get an wellness visit, get a basic test every once in a year, something like. Similar to that, we'll do for the pediatrics also. This is not only for the vaccination or cough cold, just a wellness visit to know your child is growing appropriate for the age and your child is absolutely doing well, everything, even because even a small issues can be picked up by a pediatrician, so that is very important. So a wellness visit will do well.
How do they diagnose obesity at home? Difficult, na?
Very difficult, sir, especially from an Indian perspective. Most of the parents, what they feel is they wanted their child to look chubby. So chubby is healthy for most of our Indian.
So you're saying chubby is not that cute?
Little bit of chubby is cute, maybe, but not the overweight and the obese one.
So I'll tell you a clear-cut scenario. So when a guest are coming over to your place, and then when the guest is saying that, oh, your kid is very cute, அப்படின்னு சொல்லிட்டு கண்ணத்தை கிள்னா, the next red flag is you need to take the kid to the pediatrician and get the growth chart checked.
Yes, yes, sir. You can do that, but let us not be very obsessed with that. Yeah, we can do that. Yeah.
What do you say?
இல்லை இன்டர்வியூ பார்த்துட்டு எல்லாருமே உடனே சப்பியாக இருந்தாலே then they should not get panic அதனால.
No. What I'm saying is, for example, in an adult, if you were overweight, you know, okay, you check your body mass index, right? So you go and step on the weight scale. A number is there. There's a height. There's a number. You just divide it, and then you get the body mass index. But that is not the case for the kids. You need to put those numbers in the growth chart. Either you get the growth chart online. Is that possible?
Yes. But I don't think so. A parent can plot on a growth chart. You have to do it with the doctor or a medical worker.
Correct. Exactly. That is my point. That is exactly my point. That without a medical help, you will not be able to diagnose obesity or overweight in kids. And you may think that is normal. This happened to my kid. Okay. So he was a little bit on the chubbier side. Okay. And then it was like 3-6 months since the pediatrician visit. So we had a get together at my place when people came over. What happens is when you are with your kid, you may not realize that they're growing big. Despite us, we eat healthy, not that much and everything. But when the person told me that, hey, Arjun, nalla vandutane, then everybody was very happy except me. So next day I made a pediatrician appointment and he was on the 90th percentile.
Oh, okay.
That was a light bulb moment for me. Like then I was like, despite being a doctor, even though before annual physical exam, so this is something that we cannot be tested at home. So medical input is definitely needed.
Definitely that is needed, sir. Yeah.
And the other angle is that, we see I saw a lot of patients in the US with fatty liver starting around like 10-11 years of age. They come for something else. They come for abdominal pain. They use the liver enzymes, and liver enzymes are elevated. Is that something that you see? How common is fatty liver in kids in India?
To be very honest, sir, we have started looking for fatty liver only very recently. This non-alcoholic fatty liver disease, NAFLD or NASH, though it has been, this terminology has been there for quite a period of time. We doctors, this terminology has come into the limelight very recently, and we have started looking for it very recently. And yes, there are children who are obese. They have this NAFLD, and we are trying to get it sorted out. And yes, out of obese children, if you ask me, if I'm seeing some 100 children with obesity, I can tell somewhere around 10 to 15 will have a NAFLD.
Let me ask you a very clinical question. So you know that the growth chart is 90th percentile. How do you tell that to the parent? Especially in an Indian setting.
Yeah, actually in Indian setting, out of my experience, parents are very understanding. You plot it on a chart, you show them what is normal. Tell them this 50th centile is normal, and your child is above 95th centile. His or her weight is above 95th centile for his age or age, and they understand it. They see the chart. Okay, என்னோட பையனோட இல்லை என்னோட பொண்ணோட வெயிட் வந்து இங்கே இருக்கணும், ஆனால் டாக்டர் காட்டுறது ஒரு 3 லைன் தாண்டி மேலே இருக்குது. Then they understand it, and so it is actually our job is to make them understand in a better way, in the way how they can understand it. So we have to put it in such a way. If they understand it, I'm sure almost 95% of them they have been following it. This is out of my experience.
Huh? What is the one intervention that you want the family to do when you diagnose overweight or obesity in kids?
First thing, what everybody would tell is physical activity. But if you ask me, the priority what I would put is food intake. So my priority would be reduce the food intake, put your child on a calorie deficit. Though parent may not be aware of it, pediatric gastroenterologist or a dietitian would be able to help on that. So that is very important. And of course, the physical activity, at least physical activity 1 hour a day, that should be very important. And physical activity should be like it should be games, and they should play it physically. I'll tell you a scenario. I had a patient. I told them you have to play sports every 1 hour a day for his weight to come down. After 3 months he came and he actually gained some 3 kgs. I was asking mother, இல்லை டாக்டர் எல்லாமே பண்ணிட்டு தான் இருக்கோம், நீங்கள் சொன்ன டயட் எல்லாமே ஒரு ஃபாலோ பண்ணிட்டு தான் இருக்கிறோம், விளையாடிட்டு தான் இருக்கிறான் டாக்டர், என்ன விளையாடுறான், ஃபுட்பால் விளையாடுறான், ஃபுட்பால் இவன் வெயிட்டில் எப்படி இந்த தம்பி எப்படி இஸ் பிளேயிங் இன் வீடியோ கேமில் ஃபுட்பால் விளையாடிட்டு இருக்கிறது ஒரு இதுவாக சொல்கிறாங்க அவங்க. தென் ஐ டோல்ட் ஹிம், நோ தட் டசன்ட் கவுண்ட், யூ ஹேவ் டு டேக் ஹிம் டு த கிரவுண்ட் and you have to make him play there.
I'll add this in my stand-up comedy.
No, this is a real scenario that happened to me. That fellow told me, he was some 12 years or something. That fellow, இல்லை டாக்டர் நான் டெய்லி இதில் விளையாடிட்டு இருக்கேன், PS3 விளையாடிட்டு இருக்கிறேன். He told football, டே அப்படி பண்ணக்கூடாது, you have to go to the ground and play there.
அந்த ஃபுட்பால்
you have to go to. It was me who suggested him to play football. ஏன்னா கிரிக்கெட்னா கூட நின்ன இடத்துல போங்க அடிச்சிருவாங்க, அதனால ஃபுட்பால் விளையாடு ஓடிட்டே இருக்கலாங்கிறது தான் மை பாயிண்ட். I did not know that there was something called PlayStation existingன்றது எனக்கு முன்னாடி தெரியும். நான் சின்ன பையனாக இருக்கும்போது I was not aware these children will do that. But yes, that was a sad truth. Then I understood that was my fault. I should have told him very clearly, no, you should play football in the ground, not in your PlayStation.
What is your take on breakfast cereals? Is that affecting the nutrition of other kids?
Before going to that breakfast cereals, one more thing I want to emphasize is that first, I'm seeing a lot of children, they are skipping breakfast. First thing, they are waking up, school 8 maniki, school van 8 manikina, they wake up at 7 o'clock and they want their children to get ready, they want their children to bath, brush, ஸ்கூல் ட்ரெஸ் போடணும், பேக் எடுத்து வைக்கணும், சாப்பிடணும், அண்ட் இதுக்கு நடுவில் பூப் பண்ணுறதை மறந்துடுறாங்க. தே டோன்ட் கோ ஃபார் த டாய்லெட் அண்ட் ஆல். ஸோ அதுக்கு ஒரு 15 minutes தேவைப்படும். ஸோ மிச்சம் இருக்கிற வெறும் ஒரு 5, 10, 15 minutesல they want their children, they have to do everything. So that is main reason that children have started skipping breakfast these days. And parents also, I feel like they're little bit, they have to be even more bothered about not to skip breakfast. One thing. And second thing is,
I'll argue that point.
Okay.
From a parent, I know the difficulties.
Yeah.
Okay.
Okay.
So you be the doctor, but I'm the parent.
Okay. Yes.
We are also humans.
Okay.
There is no help. Okay. And we have to keep on looking after the kid, like each and every, picking up the school, dropping from the class, coming back, cooking, taking care of the kid, taking care of the next day breakfast, next day work, doing the homework along with them. By the time they sleep, that's the only time that we get for ourselves a little bit. Okay. The next day morning, when we wake up, as you said, there's only limited amount of time.
Yeah.
So invariably, what is happening is that we are forced to get some ultra-processed
food
option as the breakfast option.
Yeah.
Why did cereals become very popular? Because it was easy.
Yeah.
You just take a milk.
Something like a fast food.
Yeah. You just take a milk, you just take a cereal, and you just put it, you give it. And I've seen many people giving this similar to fruity juice over here. There is another juice over there. In the US, they'll just keep on, just give that. And then there'll be lunch in the afternoon.
Okay.
So I'm just arguing from a parent standpoint.
I get that.
So if this needs to change, I think the sleep timing needs to change.
Yes.
So what is your take on sleep in young kids?
So after this evolution of mobile phones and TV, the sleep pattern has come down. Ideally, a child has to have at least 8 to 9 hours of sleep.
More than the adult.
Yeah, more than that, definitely.
Because they're growing.
They're growing. They have a growing brain. The brain is also growing along with them. So they have to have 8 to 9 hours of a sound sleep is what they need. So because of this gadgets, mobile and TV, the sleep time has come down because the child sleeps at 11 o'clock, 12 o'clock. அது வரைக்கும் they wake up and suddenly
Is
they
that
want.
true? They're awake until 11, 12?
Yes, sir. Yes. And they don't follow a specific pattern as well. Sometimes they sleep at 10 o'clock, sometimes they sleep at 12 o'clock, sometimes even they sleep at 1 o'clock. They wait for their parent to come, father வேலை முடிச்சிட்டு வரணும், அது வரைக்கும் they wait.
Why is consistent sleep routine important in kids?
Of course, for the circadian rhythm, they have to maintain the circadian rhythm. Only then the melatonin secretion, everything will be in a proper way. The hunger, everything will be in a proper way. Or else everything is, if you are going to disrupt your entire body mechanism, your body is completely going to get disrupted. So to maintain that circadian rhythm, you need to have a proper timing to sleep, to wake up. You need to maintain that. So that is very important. So go to bed early. You can wake up early.
So if the kid is waking up around 7, the kid needs to sleep around 9 p.m.
Yes.
Like sleep, not go to the bed.
Yeah. So usually what I suggest my children's parents is, I tell them like, wake your kid at least 2 hours before your school bus. Okay, not 1 hour, because half an hour you spend for the breakfast. Rest of the half an hour is there. So you need to put your child for brushing, getting ready for everything, and your child will be under constant pressure. Your child will be doing it under constant pressure, and child will not have a positive environment to go to school. That itself will cause a lot of psychosocial impact on the child. So you have to create a positive environment for the child. So child has to do it in a relaxed way. Like when I came here, we both met and we had a very good chat when we started, because we had a lot of time. Suppose I had come late, you are also late. We have to rush and we have to start. So it would not been a great good rapport. So basically, to have a good and positive environment and to have a good feel, they have to wake up
2
early.
hours before?
At least 2 hours before that
the
should be
school
there.
bus time.
Yes.
So you talked about melatonin, circadian rhythm, good sleep. How is that helping the growth?
We can be very precise, sir. It is something like a vicious cycle. Okay. For example, we can take a child is not sleeping properly. Child is waking up in the night. He's watching some web series, or with his parents. He's awake till 12 or 1. And what he'll do? He'll have some chips, he'll have some Pepsi, he'll have some Coke, and konja neram kalichi he'll have some pizza. Until he goes to sleep, he'll have something. So of course, he's eating a lot of trans fat, he's eating a lot of processed food, and he's going to get obese over a period of time. Once he get obese, he'll put himself more into a sedentary life, because his physical activity will come down, and he'll go into a sedentary life, and he'll prefer staying at home and doing something rather than going out and playing. He'll prefer staying inside the home. So when he stays inside the home, what he'll do? Again, he'll start with this mobile phone or TV. Then he'll do the binge eating. So this vicious cycle will keep on continuing. So this obesity, proper sleep, waking up early, everything is all interconnected together. So that is why I say that this is not something, you cannot see everything at a different perspective. It is all interconnected. So that is why a good sleep pattern, that also gives you a good hunger, that gives you a good food intake. Everything is very interconnected, and that is very important.
Screen time and weight gain, is it related?
Definitely, sir. As we have discussed, even we as adults, when we sit and watch ஒரு மூவிக்கு போகிறோம் 3 hours, சும்மா உட்கார முடியல.
So we'll eat popcorn,
We'll eat
butter,
popcorn,
caramelized.
butter popcorn, caramel popcorn, and ஒரு cold coffee வாங்கிக்கலாம்.
Correct.
That is what we do. So that is what happens with children also. So you increase the screen time, phone பார்த்துட்டே உட்கார்றாங்க, இல்லை டிவி பார்த்துட்டே உட்கார்றாங்க. They tend to munch something, or binge eating. இந்த மாதிரி போகும்போது they tend to get obese. So the attention what you show on diet, the same attention you should show also on the screen time. Because this IAP, Indian Academy of Pediatrics, has clearly told there is no screen time for children less than 2 years of age. Okay, so we'll analyze ourselves. How many of us are following that? Just because our child wanted to eat, most of the parents have started introducing mobile for them. I'll tell you, in my experience, I've even seen mother who is showing mobile for even a 3 or 4 months old kid to feed. Okay, once she started, the child starts crying. Somehow she wants to keep the child calm, and she started showing to pacify the child. She has started showing mobile. So that is also there. So this less than 2 years, definitely it is
No screen time at
no
all.
screen.
Not even like 5 minutes, 10 minutes.
No screen. Definitely no screen. Be it a TV or be it a mobile or any sort of gadget, definitely no screen. And after 2 years until 5 years, it is just going to be 1 hour, and that is not going to be at a stretch. It is going to be 30 minutes and 30 minutes. And what even IAP recommends also, no, that you should use it only for the educational purposes, not for the other purposes.
Like Dr. Pal videos.
Yeah, probably.
எப்படி plug in? So 30 minutes at a stretch.
No, not 1 hour at a stretch. You have to divide it 30 minutes and 30 minutes. And above 5 years of age, it is just going to be 2 hours a day. Maximum 2 hours a day. And again, the 2 hours is not going to be at a stretch. It is going to be in either 2 or 4 divided, like 30 minutes, 30 minutes. And basically, it is for all the educational purposes, not for anything else. And also they quote that, so boredom is not a reason to watch TV. Boredom should be used for your creativity. So that is very important, is what even IAP tells.
So for that creativity to blossom,
Yeah, you need to give a time for your child. Yeah.
parents should be there.
Yes.
I think at least 1 hour of quality time should be spent with the kids. Without any phone, without any distractions, nothing.
So we'll have like this. Every family should have a no screen time per day.
You know, one thing I like about Americans is the dinner time.
No, this is not. Dinner is, that is mandatory. No screen time during dinner, breakfast or lunch. That discipline is very mandatory. So we'll have something like a no screen time, no screen space, like for 1 hour a day. Like,
or at least 30 minutes.
30 minutes. And no, mobiles or TV should not be used in the bedroom. Something like that everybody should start following, so that the addiction to the gadgets will start gradually coming down.
Of course. Let me ask you, what is the current dinner practice here in India with kids less than 10 years of age? Let's say they have parents and then 2 kids. Do all 4 of us sit together for dinner? Commonly, based on experience or patient experience.
Okay, I'll tell you the honest answer. If you ask the kid will not know who's sitting along with him or her, because the kid will be engaged in the TV or mobile. So that is the actual scenario which is happening in recent days. So
that is the problem.
Yeah. So be it whatever the dinner, that it be a favorite food, because the child doesn't know what is the food even. He or she just sees that and they start watching at the TV. So for a child, in the recent days, the dinner time or breakfast time has become more like a screen time. So they are very interested in screen. So they wanted to eat because they can watch the screen. So their interest is not there in the food. It is actually there with the gadgets. So that is one more reason, over a period of time, these children are having a tendency to lose interest with the food which they have been liking previously. You can see, உங்களுக்கு நமக்கே ஒரு டவுட் வரும், இல்லை இதெல்லாம் இதுக்கு முன்னாடி இதெல்லாம் நல்லா தானே சாப்பிட்டுட்டு இருந்தான்.
The kid was eating something that he liked before.
Yeah.
But not anymore.
Not anymore.
That could be because of screen time.
Obviously, because you cannot link it directly to that. But because he is showing interest on something else in the screen, he is not showing any interest towards the food. So over a period of time, so from a parent's perspective, what they feel is, எப்படியோ சாப்பிட்டுட்டா போதும் டாக்டர். That is the mentality of most of the Indian parents.
Is that correct?
That is definitely not correct. So I'll tell you only 2 mindset for the Indian parent. எப்படியா சாப்பிட்டுட்டா போதும், இல்லை ஏதா சாப்பிட்டுட்டா போதும், ஏதோ ஒன்று சாப்பிட்றணும். These 2 are
somehow he needs to eat.
And something he has to eat. Yeah, like what we discussed, let it be just, even if he takes Kellogg's and Chocos every day, they're okay. Adhe சாப்பிட்டு போறான். Even if he drinks Manna Health Mix every day and he goes to school, they're okay. Manna Health Mix கொடுக்குறான், எல்லா நட்ஸ் இருக்கு டாக்டர் அதில், அதனால that is okay. So this is how most of our current mentality is.
Let me ask you, as a parent, I have been in a situation as well where, hey, he didn't eat anything and he's asking for Chocos.
Okay.
And I would say no.
Okay.
But my wife would say, it's okay. He didn't eat anything.
Okay.
What is the right way?
That is okay once in a while, sir, but that should not become a habit. That is very important. So we should not, the child also should not get bored with too much of disciplined eating and all. Once in a while, that is okay. But that should not.
No, he's not asking for it.
Okay.
So what I'm saying is, he's not hungry.
Okay.
But we think that he will need food.
Okay. No, that is, you should feed the child on demand. Even for a newborn kid, what we tell is, the mother come to a pediatrician and when she asks, 1 hour once feed பண்ணணும்னு எங்கள் மாமியார் சொல்கிறாங்க, இல்லை 2 hours once feed பண்ணணும்னு சொல்கிறாங்க, எப்படி டாக்டர் ஃபீட் பண்ணுறது? இட் இஸ் வெரி சிம்பிள். ஃபீட் ஆன் டிமாண்ட். தூங்கிட்டு இருக்க குழந்தைய எழுப்பியெல்லாம் ஃபீட் கொடுக்கக்கூடாது. feed the child whenever the baby is demanding. So ஒரு newborn babyக்கே அதுதான்னா, then what about a child who's grown up, who's able to express his hunger? So why do we have to go and worry about it? Just wait. He or she, they'll ask for the food. We can give them that time.
So some parents are concerned that the height is not that much. Okay, they are very short, so they give lots of food thinking that it will grow taller. Most of the kids catch up with their height after 14-15 years of age, correct?
Yes, that they do.
Or food can increase the height.
If they are calorie deficient, they should be the child should meet with the adequate calories to have a proper height and weight. Okay, if they are chronically calorie deficient, definitely their height is going to be affected. So that is there. But from a parents perspective, first of all, when a parent feels that a child has a low height or a stunted height, they need to meet their pediatrician and know if the child is really stunted. And there is also one more entity called as mid-parental height. Okay, so a child will grow only appropriate to their parents' height. So there is a formula for that. You take a mother, for a female child, you take a mother's height and father's plus father's height minus 13 divided by 2, and you plot it in a chart, and 8 centimeter plus or minus. A child will grow only in that, in par with that. You cannot expect, when a mother is only 150 centimeter, father is only 155 centimeter, you cannot expect the child to grow 170 centimeter, 180 centimeter. So you have to have a expectation according to that.
So mid-parental height is somewhere between the mother's height and the father's height.
Yeah, it is something, we have a formula for that, and we plot it in a chart. And during every visit, the routine wellness visit we have been talking, during every wellness visit, the pediatrician will plot and tell you that yes, your child is growing appropriate for your height, for both of your height. When the child is not growing appropriate for the parent's height, only then that becomes an issue. Then we have to look for other entity, endocrinology or malnutrition, malnourishment, everything, absorption problem. We have to look into that.
What if the child comes? What if a parent comes and tells you that look at my child, ஒல்லியா இருக்கான் டாக்டர், சாப்பிடவே மாட்டேங்கிறான்.
That is a very common scenario in India, sir.
He's very thin, he's not eating anything at all.
Even for obese child, that is what a grandmother will say. நல்லா சத்தாகிறதுக்கு ஒரு மருந்து எழுதி கொடுங்க டாக்டர், நல்லா சாப்பிடவே மாட்டேங்கிறான். So that is what Indian scenario.
It's very common, huh?
That is very common, sir.
What do you tell them?
First, what I tell them is being lean doesn't mean unhealthy. So that is very important. They need to understand that. And and also I show them this height weight chart. I plot it and tell them that your child is growing appropriate for age. His height is also good. His weight is also good. In case if weight and height is less, then I calculate his calorie intake. Maybe they might be thinking he is eating a good amount of food, which is not very common with the Indian scenario. In our Indian scenario, most of the parents feel that my child is not eating appropriate for his age. That is.
But most of the times the calorie intake is more.
Especially it is more.
Most of the times. Yeah. Why I'm saying that is they think that whatever it is kept on the plate should be completed.
The plate size is differing, sir, according to their families and custom. இவ்வளோ பெரிய பவுல் எடுத்துகிட்டு வந்து அதில் ஃபுல்லாக ரைஸ் போட்டு இதை சாப்பிடவே மாட்டேங்கிறான் டாக்டர்னா, child can eat only this much.
So the amount that goes in,
yeah,
that is the first problem.
That is the first problem. Not that the amount that is not going in. The amount is they are trying to overfeed is the major issue here. And actually, more than the child, parents feel the child's hunger. Correct. That is there. Parents and grandparents are feeling the child's hunger. Doctor, இவ்வளோ நேரம் ஆச்சு, 4 மணி நேரம் ஆச்சு, பசிக்கும்ல டாக்டர், இன்னொரு வயிற்றுல ஒன்றுமே இல்லை டாக்டர். I mean, that becomes, I don't get that. How do you feel? நீங்கள் எப்போ சாப்பிட்டீங்க சார் டாக்டர்? நான் காலையில் 9 மணிக்கு சாப்பிட்டேன். இப்போ மணி என்ன 1? உங்களுக்கு பசிக்குதா? இல்லை டாக்டர். அதே தானே அவனுக்கும். That is if he is hungry, he is going to ask for that. Why do you feel hunger for him? That is there in our Indian scenario. And we need to change about that.
Obesity can also cause sleep issues.
Yes.
Please tell me about that.
Obese children, of course, they can. If they're very obese, they're gonna snore a lot, night. And they're gonna develop obstructive sleep apnea, where they're not going to have proper sleep. They wake up in the night because of the breathing issue. They don't have a proper sleep, which can actually show impact on their studies. The next day they go to school and they keep sleeping, so their studies also get affected. So everything is interconnected. So nothing is like this is you cannot see it as a single entity. Everything is very interconnected here.
The parent should be aware of all these happenings.
Yes, that awareness is very important.
Like daytime somnolence, where the kid is sleeping
yeah,
a lot more.
Yeah.
or waking up in the middle of the night.
Yes.
All
Yes.
this because of the neck tissue
Yeah.
compressing the airways.
Pressing the airway. Yeah. So when a teacher tells the parent, ஸ்கூலில் வந்து தூங்கிட்டே இருக்கான் அப்படின்னா, just think about that. What your child might be dealing with some obstructive sleep apnea. Just check his weight. There might be other issues, something like a adenoid hypertrophy. That is all there. But you should also show some interest on whether your child is having a proper food, proper sleep, and his weight is appropriate, not adequate, appropriate. That is very important. So your parents should start thinking in that perspective as well.
Have you seen a case scenario in your practice like that, where sleep has become a main problem?
Of course, sir. Because I actually feel very bad for the children, because children's sleep pattern are becoming like doctor's sleep pattern these days, Indian doctor's sleep pattern these days, because they don't have a proper timing. They don't have a fixed timing to sleep, and they don't sleep for adequate time. Like we have been discussing, 8 to 9 hours of sound sleep, that is not there.
And have you figured it out? I'm just asking, how do you diagnose sleep problems in the kids?
It is actually in the other way. When I look at an obese child, I ask that why is he obese. Then I dig into the history. I dig a lot into the history. Then they tell me, doctor, night தூங்க டைம் ஆயிருது, அப்போ நைட் வந்து பசிக்குதுன்னு சொல்றான். That time he is eating something. So it goes in that way. So no parents are concerned about eating in the night. So eating late night, they'll sleep obviously later, and they wake up later, and they follow sedentary life and obesity. So as we have been discussing, everything is very interconnected.
Nobody's that unfortunate to have multiple problems at the same time.
Yeah.
This MSG, HFCS, monosodium glutamate, high fructose corn syrup, all this comes under this ultra processed area.
Yeah.
Is there any particular ingredient that you're worried about, or what does all this cause to the child's gut?
More than this monosodium glutamate, what they preferably call calls Ajinomoto these days. I'm more worried about this high fructose content and all that, and especially in those ultra processed food which contain a lot of fat, trans fat, and all that. So because it causes a lot of basically they are very tasty, so that is why they are processed. So the texture looks good, it has a good aroma, taste also good, it satisfies your taste buds as well as your hunger also. So you need both. So children start taking that, and
example is a donut. It's a very classic example where they make it that attractive, that tasty, and feeding up to our high fat, high sugar requirement.
High fructose content, that is obviously going to cause a lot of obesity in children. They're going to a lot of sugar, it is basically going to get converted into a fat, and they're going to become obese. It is not only about the obesity also, like you have been discussing on your videos, especially about this gut bacteria, the good bacteria, what are the bifidobacterium, lactobacilli, whatever we have in the gut. So all those bacteria gets killed. There's only the bad bacteria start growing, especially while eating those fructose based food and all. So one more thing, when you eat all that something bad, you start avoiding something which is good. That is also there. Correct. So your tummy will get filled with bad, so you don't have a space for your good food. So when you don't eat good food, again your good bacteria is not going to grow, and you're going to the child is going to have a gut dysbiosis, which is going to lead to a lot of problems later.
Do you think eggs are good for kids?
Definitely it is good, sir. What parents ask me most of the time is, doctor, நாட்டுக்கோழி முட்டை தான் கொடுக்கணும், ஆனால் அது அவ்வளோவா கிடைக்க மாட்டேங்குது, what do I do at that time? So what I tell them is, if you get country chicken egg, well and good, give. If you are not getting it, please go ahead and give this egg. Broiler chicken egg, please go ahead and give. It is not hazardous as what you think, what you have seen through WhatsApp or Facebook. It is not hazardous as that. It was actually they started manufacturing it only after it came into the limelight. The malnutrition, protein energy malnutrition started coming down. So that was the reason it came into the scenario. So please start having that. So that is what I tell my patients.
So what is this 3-bite rule for kids?
This is actually a very new scenario. So for example, you introduce a new food for a child. The child is showing a lot of avoidance. Child doesn't want to take that. So you tell the child, have 3 bites. Then you tell. So this is this 3-bite concept. So have 3 bites and you tell. But it is very difficult to implement. And because when a child says no for a food, it is no.
It is no.
Even if you tell that it is 3 bite, சரி இப்போ ஒளிஞ்சு போ உனக்காக வேணா ஒரு வாய் சாப்பிட்டு போகிறேன் அவ்வளோதான். So definitely he is not going to have a lot of interest in the food. So this 3-bite technique and all is not going to work.
But I'm asking you as a parent, okay? So I wanted my child to eat broccoli really bad.
Okay.
Okay. So my first child I was just pampering him a lot.
Okay.
So I said, okay, if you don't want it, that's okay. Now he is not eating it at all.
Okay.
So let's say there is no vegetables in the food at all. It's a very common scenario. Many kids don't like vegetables.
Okay.
If a parent wants to introduce vegetables in the diet for him, maybe they are seeing our channel, your channel.
Okay.
How should they introduce the vegetable to the diet?
First of all, you can introduce a vegetable or any food. What you need to understand is you should not force a child. You need to offer them, but do not force. If they don't want to take it, please don't force, but keep offering them repeatedly, not on the same day, maybe at a different situation, again on some other day you make it, and keep offering him. So at one point of time they might take that. So if you start forcing them, the child will start developing aversion to the food. The environment itself will become very disruptive. The child will feel that the dining table environment itself will look very bad. It will look like a battlefield for the child. My mom will start forcing me, I have to go and eat, I have to do something which I don't like. So
Sir, I've seen actually right in front of me where they have actually forced the child to eat. He will vomit.
yeah, that is a condition called post-traumatic feeding disorder. It is a trauma. You go and put food inside the child's pharynx directly, not in the mouth. Put directly into the pharynx.
throat.
Yeah, into the throat.
I've seen that happening. I've seen that.
And the child vomits it, and definitely the child will not like that environment. The child will start hating that environment. Even in a very small baby, or bowl of rice eduthu, when they start mixing, the child will turn his face. Because he knows, even if he is only 7 or 8 months, he knows, no, my mother is going to come and force me. Even if I'm not feeling hungry, I'm not interested, but he wants me to eat that, and the anda fulla she wants me to eat, so she will put into my oropharynx, so I have to close my mouth. Child will close his mouth very tight, and he'll turn his head the other side. This is a very common scenario that mother will come, and especially grandmothers will tell, பவுல் எடுத்து சாப்பாடை பிசைஞ்சாலே மூஞ்சி அப்படி திருப்பிக்கிறாங்க. So that scenario is there here. So that is also need to be understood by the parents.
So no means no starts right there.
Yeah.
That's a deep statement. You go home and look into it. Constipation. Very common in kids?
Definitely very common, which is actually underdiagnosed. Sometimes parents are aware of it, but they don't want to, they feel that this is not going to cause issue. What is that? My child is not pooping, that's all. I'm okay with that. That is the mentality that starts with. But what happens is, child even who are like 7 years, 8 years, 9 years, they have fecal incontinence. Fecal incontinence, very simple. They tend to pass motion without their knowledge in their undergarments. Even 8 years, 9 years, female children, male children, everybody. So because of this chronic constipation issue, because what happens is there is a lot of stool remaining in the rectum. It becomes very hard. At one point of time, they lose the sensation in the anal sphincter, and the liquid stool which is there in the up, it percolates down and it will come down. Only after passing the stool, the child knows, okay, I have passed the stool. Only after that the child knows. So
you see that often in your
yes, very often, and most of the time little older children like above 5 years, they feel very embarrassed because it happens in the school. So that is very important, because it not only causes embarrassment, this fecal incontinence, later it can also lead to bowel bladder dysfunction, where this excessive stool in the rectum which can go and press the urinary bladder's neck, and it can cause urinary infection, sometimes even vesicoureteric reflux also.
Yes. You know, I did like a collab with a pediatric urologist.
Okay.
And the one thing that they said was frequent UTI is being caused because of constipation.
Definitely that. So when a child who comes with a recurrent UTI, what I look into is whether the child is having an underlying constipation. Without treating the constipation, this UTI is not going to get better. That is going to recur. So constipation, it can, if it is there for a long time, it can cause bowel bladder dysfunction and urinary issues.
So as a parent, how do I know that my kid is constipated?
Very simple, sir. Just ensure that your child is passing stool at least 3 times a week. This 3 times a week is, it can be even every day. Also, what is very important is your child has to pass stool without any distress or without any pain. That is very important. Okay. So, in our Indian scenario, it is the other way. So, what we do is we force the child to eat. But nobody tells the child, no, you go and sit in the toilet and try to poop. It has to be in the reverse way. They have to tell the child, you eat whenever you feel hungry. Even if you're not feeling like pooping, just go and sit in the toilet and try to poop. So that discipline has to be made from the childhood, because what the European or the Indian scenario tells, all guideline tells, when your child is around 1.5 to 2 years of age, start toilet training by that time. So after meal, morning and night after meal, take your child to the toilet, make him sit in the position for at least 10 minutes. So that has to be followed every day. Even if the child is not pooping, also fine. But make him sit in that position for 10 minutes. That is very important.
What are you talking about? After dinner, when you take the child to go to the bathroom?
Yes. Because,
sit over there?
Yeah, because after having coffee, we feel like pooping. No?
The motility increases.
Yeah, the gastrocolic reflex is there. So this comes as a complaint to me. Saaptone motion parent doctor. What parents feel that saapta abde odane motion la vandru is what. But it is going to take hours. So only because of the gastrocolic reflex, whatever stool is there.
So parents think that whatever they are eating, it comes down as a bowel movement.
Yeah, immediately. So it is not that way. So actually, the treatment for constipation itself, one more treatment is that exact proper toilet training, making the child sitting after taking a laxative after food, give the food, laxative after the food, then after laxative, go on sit in the toilet for 10 to 15 minutes. That is the complete treatment. So it is not only giving laxative. It is actually laxative is for a brief period of time for a chronic constipation. For a functional constipation, it is going to be only for 4 to 6 months. So this 4 to 6 months, you are buying time to toilet train your child. So that is very important. This toilet training is making your child sit. Because there are a lot of children who still stands and poops beyond 3 years, 4 years also, because they are not being toilet trained. So what happens is, when the stool is very hard because of the constipation, they don't want to pass it because it will pain.
It's painful.
Yeah, so they want to stand and they want to retain it. They try to retain that. And the stool again becomes even more harder. And even then, after that, it will be even more painful. So they don't want to pass it. So this cycle keeps on continuing. So that is why it is a bit difficult. So what they expect is things to change in a day. So they have to understand.
It takes time.
It will take its time. It will take at least 4 to 5 months. At least you have to wait.
For kids having constipation issues, Indian toilet or Western toilet? Or is this the reason for constipation?
Both are fine, sir. Indian toilet is also fine. Western toilet is also fine. Only thing what you have to ensure, to me, what I feel is putting in the toilet itself is first fine. Because what happens is, they put this potty seater in the hall, make the child watch TV, or mother will be inside the kitchen. She'll be asking from the kitchen. Child will be in the hall, putting the potty seater in the hall, and they'll make the child poop. Or they'll put the potty seater at the veranda or somewhere. The child will be watching somebody going and coming. They'll put that. So put the child in the toilet first. That is there. Second thing, it can be Indian toilet or it can be even Western toilet. What we have to ensure is, in the Western toilet, the baby's legs are not hanging. It should be put in the child should rest the legs in a stool. So only then the child will feel comfortable and he'll start passing the stool. So that is very important.
But I don't think that is being practiced commonly.
No. That positioning is not, people are not much aware about that. So we'll have to educate people about that also.
The stool also have to change because the kid is growing.
Yeah.
All personal experience. So laxative-wise, psyllium husk in case if needed?
One more point to be added to that Western and Indian toilets. And if you're putting a child when your child is in a toilet training phase, be it example for a 2.5 year or 3 year, if you're putting a child in a Western toilet, put him in a Western toilet every day during toilet training. Don't change it to Western toilet one day, Indian toilet one day. If you're putting in a potty seater, put that potty seater inside the toilet. Don't keep that potty seater one day in the hall, one day in the kitchen, one day in the veranda. Not like that. Keep that potty seater inside the bathroom. Only then there is a rule of one. There's something called as a rule of one. You have to put the child in one place every day, in the one toilet every day at one particular time. This one particular time is after meal. after food.
Because
And
after meal, the colonic motility
the
increases.
gastrocolic reflex is there, and actually by only by one person. Okay, if it is mom, it should be mom. If it is a grandmother, it should be grandmother. If it is a father, it should be father. It is not like one day grandmother, one day grandfather. It is not like that. Until the child gets toilet trained. At least during the training phase, this should be judiciously followed.
Consistent.
This consistency should be there.
Rule of one.
Yes. And one more thing, this rule of one, they should talk only one word inside the toilet. Because most of the children, they'll be trying to talk all stories inside the
correct.
toilet. I think personal experience.
I have seen that.
Okay.
I have said so many Ramayana stories only
Yeah.
in the
In
toilet.
the toilet. So that should also not be done. So
Then what will we do? Somebody needs to stand right next to them,
you can
right?
stand, sir. You don't have to speak anything inside.
Let a kid come to you. உங்களுக்கு ஒரு பொழுது வரக்கட்டும். So you're saying that the kid will be in the bathroom, right, have a bowel movement, you stay right there or nearby so that making sure nothing happens to them. But don't talk.
Yes, sir.
But I have seen people giving mobile.
Mobile. That is also.
I've seen people giving a phone. One day in a get together, we didn't know where the kid was.
Okay.
And then my friend, he says, my phone is also lost. Okay, so he'll be in the bathroom.
Oh, okay.
That's how they correlated. Okay, so
what parents have to understand is they should also start following all this.
Of course.
In the dining table, if they start using the gadget, the child also will use. The father takes the mobile inside the toilet, the child also will show the hand. See, my father is also taking. That happens during, say, எங்க அப்பா எடுத்துட்டு போறாரு, எங்க அப்பா phone பேசிட்டே தான் சாப்பிடுறாரு. That's what the child tells. So basically
they'll tell that to you?
Yeah, the children, they have told it to me. So this change should start with the parents actually.
Of course. Kids grasp it very quickly.
Yeah,
Huh?
yes, sir.
One thing is, I want to talk to you about the foreign body in the kids. I have seen people actually, when they are playing toys, it gets stuck in their esophagus and everything. What is the thing that we should worry about when young kids are playing with small toys? Whether it's a possibility of any getting stuck somewhere.
More than the toys, it is actually the batteries these days are which are there inside the toys. All those China toys which has this dancing and colorful lights and dancing dolls, colorful lights. They all have this batteries, the kutti size or button battery.
Button
batteries. So the children are very known to swallow all this because they take that and they see, and in no time they just put it inside their mouth and they swallow that. Most of the times it is okay. I mean, it is not causing major issue, but it depends upon the size of the battery also. If it is small button battery, okay. If it is a single battery, okay. But still, we have to be very cautious. But when the size of the battery is little bigger, something like a 1 rupee coin and all, it is going to cause a lot of issues, starting from the esophagus, stomach. And it is not only the battery, it is going, they swallow, like in my experience, I've seen coin, magnets. I remember in last Diwali, and my wife knows that well. Last Diwali, I had a child who swallowed the jimiki. I have a picture. I can even give you the X-ray picture. The child swallowed jimiki, which is stuck in the esophagus.
Oh my God!
It took 2 hours to remove it with an endoscope.
Jimiki from the mother?
Mother, yes.
So, they might have removed the jimiki, placed it on the table.
She had placed it somewhere, and this 2-year-old kid has swallowed it. So, children are very notorious in that, and they might swallow anything. It is not only the toys, it is not only the coin, it can be anything. So, first thing, very important thing, be very, prevention is very better than cure. So, please keep this aside from the children's reachable places.
Childproof,
Definitely, sir. Second thing, if they swallow something like that, just immediately reach out to a pediatrician or a pediatric gastroenterologist and ensure you're not giving anything before that. What they think is, if I give some banana, it will come out in the poop immediately. So that is not true. So for example, if it is stuck in the esophagus, you're giving some banana, when the child comes, I do an X-ray, I see a battery which is stuck in the esophagus. I cannot go and remove it immediately because the banana is also there. You feed your child. So what will I do? So that is very, so if your child, if you're very sure, or if you even have a doubt that your child has swallowed something, immediately take your child to a pediatrician or a pediatric gastroenterologist.
I've seen cases where in adults also they swallow button battery in psychiatric disturbances.
Yeah, okay.
Right, where and then the button battery is really caustic injury to the food pipe, where it can actually irritate the esophagus, put a hole in it.
Yeah, yes, sir, yes.
Tell me a case scenario where you have seen something like this.
I've seen a child who was swallowed a disc battery. Disc battery is little bigger than the button battery, which has got actually stuck in the esophagus. The child turned out some 48 hours later to us, and I removed it after some 48 hours
By doing a
by doing an
endoscopy.
endoscopy. Yeah, but there was a very severe mucosal injury was there.
The lining.
Yeah, no, not the entire esophagus, in a particular point.
Particular area.
Yeah, after some 3 months, the child came with a difficulty in swallowing. So when I did an endoscopy
procedure.
again, the child had gone for a stricture.
Narrowing.
The esophagus has gone for a narrowing because that wound while healing, the esophagus was like this before. While healing, it has got narrowed. So now we have to go and dilate it. So this is very, very, very pathetic situation where we have to deal with all this. So
And that's a long-term problem. They may not even get better.
they don't get better very easily.
So I wanted to wrap this up by quickly briefing on this very personal topic on myself. Where I'm very interested in this topic of inflammatory bowel disease. It may be too technical for audience, but I think people who have this disease should really know from a pediatric gastroenterology. So inflammatory bowel disease is an autoimmune disease where your body thinks that your colon doesn't belong to you. So it starts eating up your colon, leading to colitis. It's a very common thing in the adult population. It was only the Western disease, but now it's happening in the India as well. And I have my own theory why that is happening in breakage in the gut lining and everything. But you will not believe how many emails that I get on a daily basis.
Okay.
Of so many people around the world.
Okay.
That, my 13-year-old is diagnosed with Crohn's disease, 15-year-old with ulcerative colitis. Why is this getting more common?
As you said, unfortunately, this disease of Western countries has come into India also, and unfortunately, it is there in our children. In my experience, I've even seen a child who's just 2.5 years with Crohn's disease recently. So, which is very pathetic. So, it is very simple, sir. Like the disease which was in the Western countries, it has come here. Probably because the Western food we have started.
It's food related, huh?
Yeah, it should be
mainly food related.
Though there might be some
genetic
and
as
environmental
well.
factors. I feel this food also plays a major role because
so.
everything is with the gut bacteria, gut microbiota, dysbiosis. So though we may be sounding little technical for the audience, but still that is the truth. So what they have to understand is to eat the healthy food and to be aware what is actual healthy food. So IBDs are becoming, I would say, not very common, but I would say it is not uncommon these days.
Correct.
So IBD in children are not very uncommon these days in Indian scenario. So an IBD, as you know, is a very
complex
traumatizing disease for the child as well as the family, and it needs a lot of mental support for the family. And
so can we give some guidelines in terms of when should a kid should reach a gastroenterologist? I feel like sooner the better. But what are the symptoms that we can look for? So maybe blood in stools?
Blood in stools with some diarrhea also.
With some diarrhea.
Because some simple anal fissure will also go because of the recurrent constipation. Child will also have a blood in stools. So diarrhea, which is persisting for a period of more than 2 weeks with some blood in stools. Sometimes even without blood in stools. But if the diarrhea is there on beyond a period of 2 or 3 weeks, then you have to get evaluated for IBD. That is very important because earlier you pick it up, earlier you start treating, earlier the child becomes better. Because comparing to the adult, in adult they have already grown up.
Correct.
Whereas in children they are in a growing up stage. If their nutritional requirement are not met adequately, there are high chances they may turn it into a long-term malnourished, or even the puberty can get affected. So all that is there. So especially in Crohn's disease, which is actually does not only affect the gut alone, it can be multisystemic also.
So when a kid's growth is not meeting the growth chart, these are all possible diagnoses, correct? Not only this, celiac disease, allergic to gluten. For putting IBD, if the child is not growing appropriate for age, along with that, child should have some diarrhea. So diarrhea, blood in stools, or some unexplained vomiting, the child should get evaluated. So can you describe a case that you are dealing with?
This is a very recent child, probably 6 days back. She's a 12-year-old child who was weighing only 16 kg. If I'm not wrong, they are from Thiruvarur. She's only 16 kg. She has been symptomatic for the last 6 years.
Wow.
She's 12 years.
From age 6?
Yeah. For the 6 years, she has been having on and off diarrhea. What has bothered them recently is the child has started having little bit of blood in the stools now. Okay, that has been the botheration. So they came to me. When I saw the child, I couldn't believe she was 12 years because her height was she was very stunted. She was only 16 kg when she is 12 years. So she's 12 years. She has to first gain her weight. She has to gain her height. Then she has to achieve her puberty.
Correct.
Everything is there. So it is not only the problem of diarrhea alone. So I ensured that I'm not dealing with any other issues, and I did a scopy, and she had a very bad colitis, a pan colitis, skip lesions was there. Even in the ileum, there were a lot of ulcers.
So the colon was completely inflamed.
Completely inflamed, involving the ileum also.
Small
and there were
intestine as well.
microgranuloma also in the histopathology. So
Classic Crohn's.
Classic Crohn's it was. And unfortunately, even the MR enterography also, I could not get it done because the child was vomiting. So
The contrast.
contrast child was vomiting. So small bowel evaluation was not completed. But still, I was able to diagnose it at Crohn's, and I started a step-down therapy. Started this child with infliximab because her scoring was very high.
Very bad.
Pediatric Crohn's disease activity index scoring was somewhere around 60.
So infliximab is a medication that will suppress your immunity. So
yeah.
in turn, the colon will get better.
Colon will get better over a period of time.
So that's happening.
Yeah. So we have just started. 3-4 days back, we have started.
Cost of infliximab here in Chennai or Tamil Nadu?
In Tamil Nadu, the cost we can give it for actual MRP is 25,000, but the companies they give it for 17,000-18,000 because they're going to need it for a longer time. Every 2 months, once they're going to need it, at least for a period of 1 year, they're going to get it. So considering that, for that they're giving this subsidized cost and all.
In the US, the problem is one infusion is $4,000. Right? So they need so much. So insurance will not approve.
Oh, okay.
So I have to call the insurance every day and explain that, hey, the patient needs it.
Okay.
You have to approve it.
Even US insurance also denies.
Of course.
Okay.
Of course.
I thought only this is a problem only with the Star Health insurance.
I know here in India, they deny even when you come to the hospital.
Endoscopy also, I recently had a call. Why was it done on OP basis? I was like, see, 2-year-old child, how can I do it on OP basis, man? I need to admit the child and do it under sedation. A 2-year-old child will not definitely cooperate for an endoscopy and colonoscopy for sure. So how can I do it on an OP basis?
My family member was admitted with gastroenteritis in the hospital. It was like 7 days. And the decliner was because, it's a simple gastroenteritis, so we cannot cover.
Okay.
But he had kidney injury, he had he had like significant volume depletion and supplementation. And then this family member wanted me to talk to them.
Okay.
I said, I'm talking to the US insurance, I'm talking to the Indian insurance company.
Okay.
But anyways, wow, so what's this wonderful conversation. Wonderful. Thank you, Rakesh. You are such a beaming energy. I think your career is going to be huge, bright. I'm so happy. And we learned a lot, and I'm sure the audience learned a lot as well. Thank you so much for your time.
Thank you, sir. Keep inspiring us every time.
Oh, thank you, Rakesh. Thank you.
Thank you, sir. Nice meeting you.
Thank you.
Thank you.
That was a wonderful session. I really, really liked it. I'm going to bring him back again, and maybe I'll do a podcast in Tamil as well, and so that his jokes and everything was like spot on. I really feel like I learned a lot, and I really want you to let me know what you learned on the comment section. And I also want to again ask you if you feel like this is very technical and which part could be a little bit trimmed down to a layman term so that we can make the podcast reach many audience to spread the information in the way that what we want to. So I really want your input on this. So please help me out. Again, remember, one belly at a time. It is absolutely important. Stay happy, stay gutsy. May God bless you.